Hi everyone, this is BTBrummie and this is episode 6 of Head Cases and Brain Farts. So, today we're going to talk to you a little bit about pain after you've had an operation. More specifically, really around if you have a craniotomy, because that's where my experience lies. I've had 3 of them now, so yeah, I pretty much kind of know what to expect with most of it. So hopefully some of the things that I wasn't told that I've been through will help you at least maybe prepare for what is about to occur. I won't go into too much details about the prep because really that's the same as every other operation that you go through. I will talk to you about what to expect afterwards. First of all, I just want to say, I know we seem to be zipping around subjects. There doesn't seem to be any kind of timeline going on, like from diagnosis through to all sorts of things now. I thought a lot about sort of doing that, but then I figured with the different people we've got watching, with, you know, all the different parts of their journeys that they're on, like some of them have already had craniotomies, some of them are at the beginning of their journey, some in the middle, some at the end. And it just felt kind of unfair of making people that sort of want advice about the operation as they're about to go in it, to make them wait like months and months and months until we get to that subject. So it was decided that we would just mix it up a little bit and see how it went and see how you all responded. You know, if you like the fact that we're jumping around and doing different subjects, because it means then that more of you can watch and get some advice out of it, then great. But if you'd like us to go to a routine, if you would like us to work in a certain order, then please feel free to get in touch and let us know your opinions and your thoughts. And if enough of you want us to go back to some kind of an order, then we will certainly consider it. Craniotomies. Wow. Where to start? Well, as you know, craniotomies are used mostly to remove tumours. Now, you can be opened up on your skull pretty much all sorts of different ways. The most usual way that they open up is that they will do a C shape running from the top of your forehead here, and it will come around down by your ear and then round back in front of your ear and sort of finish here. That's the traditional one when they're trying to get to the frontal lobe or any of the tumours at the front of your brain. Then there's the midline section. Now that can usually go from about midway across your skull and then as far across as they feel they need to go, again depending on where your tumour is. And then of course there's the tumours at the back. Now they don't normally like to go anywhere near your spine, so if you're having that kind of a craniotomy, there's usually special precautions and special cuts that they make so that they sort of lower the risk. But obviously remember, these are professionals, they know what they're doing, so get all the information out of them that you feel comfortable with, and then you really just need to try and trust them and, you know, relax. Although that sounds really stupid to say, but I can't tell you the amount of people that told me to do that right before my surgery. And we'll get on to silly things to say about brain tumours at some point in a future episode, I'm sure. What to expect when you come round. Now, the reason this one is so important to me is because although I was told I would have some swelling when I came round from the operation, I wasn't told exactly how much to expect. It really is, well, it really can be quite dramatic. I mean, there are a few people that I've known have craniotomies and they've had very little swelling, but on the whole, the majority of people that I've spoken to during my research and for myself after all 3 craniotomies, there is usually a lot of swelling, and it is not unusual. It is nothing to be worried about. It is perfectly normal. It's just your skin and your body reacting to the trauma that it's been through from having your head and then your skull bone cut open. Now, I'm trying not to get too graphic and too gruesome here because I know people can be a little bit squeamish. I'm going to do my best, so bear with me if I'm sort of taking a few moments to try and find the right language to use. Normally, as well as the swelling, you're going to get a black eye, at least one. Perhaps both eyes will swell. You will certainly get some bruising, and I mean some quite horrific looking bruising. Black, purple, blue, you name it, you're going to go every colour under the rainbow. Again, it's normal. It's so normal, but they forget to tell you these little bits of information. You normally will wake up with most of the bruising and the swelling already there, already in place. Now, you'll be too groggy at first to take much notice. You'll be on very strong painkillers and you'll still be tired and not quite with it from the anaesthetic. So you probably won't even be aware at first of what's going on. But as you sort of get more lucid and you come round, eventually you're going to want to go to the bathroom if you've not had a catheter put in. And again, that depends on how long they expect your surgery to last as to whether they use one. Your surgeon and your anaesthetist will go through all of this in your pre-op appointment, or they should do. If they don't, ask them, am I going to have a catheter? It's just a question. They won't mind answering it. That is what they're there for at that particular time. Hopefully, you will wake up with the swelling and the bruising and the black eyes. Now, the reason I say I hope you're going to wake up with them is because if you don't, it's a slightly more painful process. It's like anything else that happens to your body. If it happens slowly and comes on more gradually, it can actually be more painful. Now, I've had 3 craniotomies. 2 of them, I was very lucky. I woke up. I had the swelling and the bruising was out straight away. Therefore, the pain I was in was, you know, the normal amount of pain I would expect from a craniotomy. And basically, they will be giving you cocodamol, usually, anti-inflammatories to sort of help with things. So your pain level should be reasonably under control. But if you are in any more pain, if you are feeling it through those painkillers, then you need to tell the nurse and the doctor that are looking after you. You know, it's their job to make sure that you are as little pain as possible while you recover. If the swelling hasn't come out, as I said, it can be quite painful. The things that I would pack in your bag to help you with this is a flannel and an ice pack. Sometimes the hospitals do have ice packs on hand and you'll be able to ask them for one, but sometimes they don't. And I found having my flannel with me enabled me to sort of dunk it in cold water and then spread it over my face, because what happens when the swelling is trying to come out, it's like a burning sensation while your face is sort of swelling and bruising. It's almost like a bee sting times 20, if you've ever been stung by a bee, or a wasp for that matter. But once the swelling is actually out, which can take anywhere between 12 and 24 hours, I reckon is usually the case. Once that swelling is out, you will find the pain subsides to a much more reasonable level. But it is really uncomfortable and it is quite sore. If that's happening, then again, you need to talk to your doctor and to your nurse and tell them that it is really painful, and they will help you. And if you're already on the cocodamol and that, then there is a drug called Oromorph that they can give you. You're normally given that as you're coming round from surgery anyway, but you can take the doses for longer if you are in a lot more pain and still very uncomfortable from the swelling. I just implore you, don't try and struggle in silence. Don't think you're bothering the nurses. Don't think that you should be letting them deal with more urgent patients. You are an important patient. You're you, and you don't need to be in pain if you don't have to be. So please talk to them and ask them to get you some more pain relief. And I promise, they're not going to be bothered by that. They will go and see your doctor and they will find out what else you can be prescribed. Or it may be just that the painkillers are wearing off and you're due another dose anyway, and they will go and get it for you. Trust me, they are there to try and help you. All you've got to do is tell them that you need it. And, you know, hopefully they will do exactly that. Once you've had the craniotomy and all the swelling's come out and you've been in hospital and the doctors are happy with you, it'll be time to go home. Now, being in hospital really does vary on what kind of craniotomy you've had, the kind of tumour that you've had removed, if you've been having side effects like you've been fitting, or from the operation itself you've been left with some kind of problem or issue, then again, it depends. You'll normally see the physiotherapist. They'll come round, make sure that you can walk and move and that you're all back to your normal self. They'll speak to the doctor, they'll sign you off and you'll be able to go home. Now, it really does vary. As I said, I've had 3 craniotomies now. So the first time I actually was out in 2 days. 2 days. And that was after finding myself in the high dependency unit because of my blood pressure. It does show you how quickly the body can bounce back. Whereas the second time, because the swelling hadn't come out on my face and I was in a lot more pain, I was actually in for nearer to a week because they weren't happy for me to go home while I was still in so much pain. And I'm very grateful that they kept me there for that time, trust me. The third time, I actually was in for quite a long time because I'd had the craniotomy due to having an infection, and I still had to stay on IV antibiotics for quite a long period of time after this. But that's something that we'll cover in complications at a later date in another episode. But it really does depend. Sometimes you can be in for 2 days, sometimes you could be in for 2 weeks. And if things are unfortunately very bad for you, you could be in for 2 months. I mean, it really does depend on how well you recover once you wake up. Once you're home, or once you're getting ready to go home, you're going to be given like this huge bag of medication. You're going to be given steroids possibly to reduce any swelling and make sure you don't swell after the operation. You'll be given painkillers. You will be given something to help you go to the bathroom while you're on those painkillers. And trust me, you do not want to stop taking those before you reduce your painkillers at all. You may be given anti-inflammatories as well to help with the swelling on your face if you've still got any. All I really want to stress about this is don't cut yourself off too soon. Don't think you're brave and you're okay and cut down on your painkillers because you just think you shouldn't be on them. When you feel you're ready to decrease your painkillers, go and talk to your GP. I mean, personally, my opinion, I wouldn't start reducing my painkillers until I'd had my stitches out. Once you've had your stitches out, then, you know, it's been usually 10 days, 15 days, then maybe you can think about reducing your painkillers. But before then, if you feel really well and you want to, please talk to your GP or talk to your neurologist or your neurosurgeon if you've been back to see them or you're still in hospital, and just ask them if you can, you know, start reducing them a little bit and check that everything is still okay. If you do reduce them and all of a sudden the pain comes piling back on, go straight back onto the dose you were given by your GP. It really just is about following their instructions. You know, they're the experts. But it is still your body, and painkillers can have some really nasty side effects. And, you know, this is why we're given laxatives and drugs to help us go to the bathroom, because that's usually the main one. And you just don't want to put your body through any more trauma than it's already been through. So it's really important to remember to take all your medication and not try to rush yourself into thinking you're okay when you might not be okay. The other thing to watch out for, of course, is complications. If for some reason you suddenly start feeling a lot more pain and you're still on the same amount of painkillers, that's the time when you need to get in touch with your GP. Or get back in touch with the ward that you were discharged from and tell them the problem that you're having, that even though you're still taking the painkillers, you know, you're still in a lot of pain. You know, check things out. Don't leave things to chance. You know, this is your brain. This is something that you need to function as a human being. Just any problems, any worries, get in touch with your GP or a doctor. They are the people that can help you. They're the people that can reassure you. They can check you over and make sure everything's okay. And just trust them. You know, they're there to help you. And it really is important that you do as they say. So if you're told not to bend over, not to pick things up that are heavy, and trust me, they're very important, you are being told them for a reason. And they should explain this, but as I've mentioned those things very briefly, the reason you're told not to bend over or pick anything heavy up, I will get my words out, I promise. It's because when you bend over or anything, it's like when you have a sinus infection, it actually builds up the pressure in your head. And that's exactly what we're trying to avoid after a craniotomy. You don't want the pressure building because it's very dangerous after you've had your brain messed with. So you should be told all of this anyway, but please don't bend over. Don't lift anything heavy. Not for several weeks, if not months after your surgery. It's really quite important. And if you want more of an explanation, again, GP, neurosurgeon, or even your neurologist, just talk to someone who knows what they're talking about, because I might not. Okay, so I think really that's it about pain and after a craniotomy. Just do what feels right for you, but please don't stop taking any medication without any medical advice. It's really important, trust me. Oh, right, well, today our mystery spot is a lady called JennaMarbles. Oh, dear me, this lady. She is really funny, she's very down to earth, and she finds humour in the most ordinary situations. From putting on your makeup when you're drunk, although that isn't going to really be an issue for us for a while as we're not allowed to drink. And she does things like filming herself making a meal for her boyfriend, or one of my favourites is the donut challenge that she does. So give her a watch. She's really funny and very down to earth and just a normal person that likes to make people laugh, and I find that very admirable. So JennaMarbles, as usual, her details will be in the comments below, so go and check her out. So that's it for today's episode. I really hope that you got something out of it and that you find something useful from it, and I really look forward to seeing you next Monday. So please don't forget to like, share and subscribe. Take care of yourselves, everyone. Bye for now.